Hi, it's Erie County Executive Mark Poloncarz here for another Facebook Live Town Hall meeting with people in our community, as well as I know members of the news media who will be participating and asking questions. You can ask questions of myself, and today I'm joined by the Commissioner of the Department of Senior Services, David Schenk. David was also, and still somewhat filling in, as our head of our Veteran Service Office as we come up with his replacement, which everything's been kind of tossed to the side now with regards to the issues associated with coronavirus. But David is also here to talk a little bit about senior service issues, as well as if you got some questions on veterans issues, David can answer them as well. I once again have a presentation to give with updated information. And as usual, I just want to thank the people of our community for the good work that you're doing to create a better county for all of us during these very stressful times, for following the rules with regards to proper physical distancing, keeping social contact with each other, but being a distance apart. As I reported yesterday on Twitter, there's a national organization that's keeping track of social distancing based on measuring how people are traveling through their phones. Pretty much if you got a phone, they can keep track of what you're doing. If you didn't know that, you should know that. But we were rated an A in Erie County for physical distancing by dropping off the amount that we're traveling, and so that's a good thing, and I want to thank everybody for doing that. Once again, we'll go through the presentation as we've had in the past. Dan Meyer from my office is manning the laptop over there, and he'll be asking questions, which I'll repeat in the mic because I'm not certain if you're going to be able to hear it, Dan, from over there. And of course, we're trying to keep our physical distance, and we're glad to be here also with Kate Shaver from Deaf Access Services so that we could provide this information to those that are have hearing disabilities in our community. Once again, the information is valid as when it was done. It could have changed. It probably has changed. That's what I've seen. I've walked out of some of these events and have had new information immediately given to me, but the information we're presenting today is as valid as when it was prepared. So just please remember that. Once again, we're joined by our Erie County Commissioner of Senior Services, David Schenk, and he's going to talk a little bit about some of the senior issues that we're dealing with and the resources that are available for seniors. I'm going to put my glasses on because we are down to 2 slides on a page, so I want to make certain I read this correctly. But effective as of 2:30, we have 123 lab-confirmed positive cases in Erie County for all the labs that have done testing. 515 have been negative that have gone to the Erie County Public Health Lab. 83 pending results of Erie County residents. And there are 721 tests that have been completed or pending by the Erie County Public Health Lab, but more tests have been done, completed by other agencies like Quest, LabCorp, Flint, as well as even the Mayo Clinic I saw. We're trying to get the information on the actual overall negatives. We're having a little difficulty getting that. But we know that more people have been tested than what's just been tested by the Erie County Public Health Lab. Now, a lot of questions as to who gets tested. So we're following the Public Health Lab or the New York State Department of Health testing protocols. We have reagents and swab kits, and we are doing limited testing based on these protocols. The individuals who would qualify for a test through our Erie County Department of Public Health Lab are healthcare workers and those posing risks to healthcare workers, such as individuals who are in a hospital and appear to have the symptoms of COVID-19 and are inpatient, not just outpatient, but inpatient individuals. Those that are living in a congregate setting for vulnerable groups such as nursing homes, prisons, group homes, etc., they are eligible for a test from our public health lab. Law enforcement. Unfortunately, we've had some law enforcement. I know both the Buffalo PD as well as the Erie County Sheriff's Office have law enforcement members who are actually tested positive. So law enforcement. And a perinatal symptomatic mom. So if you're about to give birth or have just given birth and you're showing the symptoms, you will be tested or at least qualify for a test. But this is all dependent upon the conversation from the Erie County Department of Health as well as your physician. So you have to go to your physician first. The physician will contact the Erie County Department of Health, and then we'll determine based on the protocols if this is an individual that should be tested, and then we would tell you how you would get tested. This is straight from the New York State Department of Health, but those who who are not recommended to be tested by the New York State Department of Health are persons already under quarantine who develop mild illness, exposed individuals with no severe underlying health conditions or not severely ill, asymptomatic contacts of confirmed cases. So even if you had a contact with the confirmed case, if you're not showing any symptoms, you won't be tested. You may be in quarantine, but you won't be tested. And mildly ill persons who do not live in congregate settings. So those are the protocols from New York State that we are following through our Erie County Department of Health Public Health Lab on the tests that we are doing. We got swab kits for we should have gotten 600 swab kits delivered in the last day. We also have approximately 350 reagents. So we're going to be doing tests based on those protocols I just talked about. Of course, that means not everyone is going to get tested by the Erie County Public Health Lab, but there are other resources out there. You should talk to your doctor. As I noted, Quest is testing. They do not take the samples if you're symptomatic, but they will test if you can have the sample taken by your doctor's office, and the same for LabCorp. So we want people to understand there are other entities out there that are testing, not just in Erie County, but across Western New York, but there are limitations on who will be tested, including at Quest or LabCorp facilities. Now, I want to give you an update on the deaths, the quarantine, isolation, and the good one that we have yet to report, but we have now recovered. Unfortunately, as we announced yesterday, we had one individual, a woman in her 80s, die yesterday. I express my deepest condolences to her family, friends, and loved ones. We were hoping that we wouldn't have a death in our community, but we did, and I'm hoping that's the last one. I do know that there are individuals in hospitalization right now, including some in the ICU, but I got the numbers too late to include in our presentation, so we'll try to prevent that. We'll provide that to media fairly soon after this presentation, so that you have got the most accurate numbers on number of individuals that are in hospital, including in the ICU. But unfortunately, we have had one person die. On a positive note, we've had 4 people who are deemed to have recovered. And hopefully, if others who are some of the earliest individuals to have received COVID-19 or have COVID-19 get through the next 24 hours okay, we'll be able to increase that number again. So one person, unfortunately, has died, but 4 have recovered, which shows you can recover from COVID-19. 118 people are in isolation. 198 individuals have completed quarantine, and 471 contacts are in quarantine as we speak. So we do have some positive news there, even among the sad news regarding the death, with regards to the individuals who have recovered. Now, community transmission. We believe almost all of the latest newer cases are from community spread, community transition. You should assume that COVID-19 is in your community no matter where you live. So just because you live in a town that may not have had a case, it's there, just might not have been tested yet. We had more cases pop up in some of the rural sections yesterday. We know some of the other counties in our area. Orleans County has just reported its first cases. Pretty much it's everywhere in Western New York, so everyone should assume it's everywhere wherever you're going. You do not need to call our information line if you believe you may have been exposed to it. Of course, if you're showing symptoms, you should call your doctor first and foremost, but just because you think you were at a location where somebody was that we may announced earlier, you should not call our hotline. That's for individuals with real health care issues. Though if you are out there, please do not underestimate the risk. You may have seen yesterday or late yesterday and early today, the Kentucky governor went out and said there was a party that was held of kids, COVID-19 party. Hey, we're immune for it. We're going to be fine. It's a bunch of COVIDiots there because a couple of them have now come down with COVID-19. This is not something you should ignore. You should not underestimate the risk. So the people out there who are thinking, I'm immune, you're not. You may actually already have it and just not showing any symptoms. If that's the case, very good for you, but you could be sharing it with someone else. That's why we're recommending that everyone continue to follow the guidelines regarding essential businesses and where you should be and not be. You should not be congregating with individuals you haven't been around. If you've been around your family, it's okay to continue to be around your family, including going to the park or whatever other activity, as long as you're not doing it with others who you haven't been around, because then you might get it if you don't have it. On monitoring, the Erie County Department of Health is monitoring and prioritizing monitoring for healthcare providers, medical facilities, family close contacts, and elderly chronic conditions. And we're talking about that. We're talking about individuals with case tracing. So we're monitoring the individuals who are connected in that way with individuals who have tested positive. We're not going to be able to monitor every individual now that we have over or approximately 120 cases. So any individual may have come in contact with an individual who's tested positive will not be able to monitor, but we are putting out as much information as we legally can and publicly should for the public's knowledge, which is assume it's everywhere. And then you can do your own community self-monitoring. Check daily for a fever, 100.4 temperature, degrees or higher. I checked my temperature again, didn't feel like I had one this morning, 98.6, right on the number. And some of our other people in our office were actually lower than that. So I always knew they were tough and cold-blooded. Now I got the proof of it. But if you have a temperature of 100.4 or higher and a cough, shortness of breath, call your doctor. Do not go to the emergency room yet. Do not go to the urgent care. Call your doctor because those are the symptoms you have to be aware of. If you have a low-grade temperature, 99, just monitor it. Could be just one day, not an issue. But if you have above 100.4, a cough, shortness of breath, call your doctor immediately. And isolate yourself at home from others, including the people that you're around, because you may have COVID-19. The case mapping, we of course have the COVID map at www.erie.gov/COVID-MAP, spelling it out so our sign language interpreter can do it a little easier. It's the interactive map that identifies positive cases by municipality. It also includes recovered and deaths. You can see this is just as of about a couple hours ago. It's not updated with the most recent information, but it does have at that point 121 confirmed cases. 116 were active cases at that time. Recovered were 4, 1 death. We can add 2 more in both the total as well as active cases. And if you go to the website right now, I'm pretty certain you'll see it there. So that always keep track of, and as you can see, we've updated it now with the information regarding recovered and death. We're not going to identify the towns, and villages, and cities for recovered and death. We think that could provide information on the location and who was the individual who may have died or recovered. So we're just going to list the recovered and death while still breaking it down by towns. Erie County's response, we've had a big response, as we all know. We've been active for a while now. Our Department of Social Services has got some important numbers you should be aware of, as well as a link. If you need temporary assistance to needy families, if you're having significant issues, loss of job, of course, you can apply for unemployment insurance online through the New York State's Department of Labor. Say that 5 times fast. But if you want to apply for temporary assistance for needy families, you can do that through Erie County government. You can call 858-8000 for an application. No in-person interview is required. Interviews can be done over the phone. And if you need to apply for what's the old food stamps program, it's now called Supplemental Nutrition Assistance Program, you can apply online through New York State at one word, mybenefits.ny.gov. Once again, that's mybenefits.ny.gov. And so our social services department is here. We are definitely on a skeletal crew, but there are individuals here taking applications, reviewing them, and making certain that people who qualify for benefits will get them. With that, I'm going to turn over to Commissioner David Shank to talk a little bit about some of the issues that his department is dealing with. So, Commissioner Shank.
All right, very good. Thanks for having me, Mark. First off, I'd like to thank my staff. They've worked tirelessly. They're working very hard. There's a few in the office. There's a lot working from home. I really appreciate all the time and the sacrifice that they are putting in. Also, all the community partners that we have. The mission of taking care of seniors cannot just be done by Erie County Senior Services. We have many community partners. And as you'll see on the slide, one of the things that we're really beginning to focus on is combating social isolation. I've been contacted by a couple different organizations. One is Oasis Senior Advisors. They have set up caring cards for seniors program.
Actually, why don't we go, that's the couple slides away.
Okay.
So why don't we start with the helpline
Okay.
and what the senior service department does.
Okay, great. So focusing on our helpline, what's our New York Connects line? That number is 858-8526. That's the number that you need to remember if you want to call us. That's our intake line. One of the most important things is providing good nutrition for our seniors. So we have a home-delivered meal program. You might remember that we had congregate dining. That had to be shut down about a week and a half ago because we wanted to keep our social distancing. So since then, we've increased the home-delivered meals by approximately 400 people so far. That number is continuing to grow every day. We have a few commissaries that we deal with. Some, they offer different programs. Some is Tuesday, Thursday. Another is Monday, Wednesday, Friday, and some are 5 days a week. Most offer a 2-meal combo. So when the delivery person comes, that delivery person will maintain the 6-foot distance. So please know that you will have that distance and you'll stay safe when the delivery person comes. They offer a hot and a cold meal, so that way you can have the hot for lunch and you can have the cold meal later on for dinner. Those who are under age 60, you can call Feed-More Western New York directly, and that number is 822-2002. Again, that's Feed-More Western New York, 822-2002. If you're under age 60. If you're 60 and older, call us directly. I will ask that those people who are calling and have already registered, that I ask that you do please be patient. We're adding on about 50 people a day. The system is getting bottlenecked, if you will, so it's going to take a couple days before you receive your first meal, so please be patient. Now, we have contracted agencies with Feed-More Western New York, which is the largest organization in Erie County. We have Meals on Wheels of Kenton and Meals on Wheels of Amherst. With those, we have a suggested donation of $3. We also have 4 independent Meals on Wheels organizations. There's Twin City, which is up in the Tonawanda area. We have Alden, Grand Island, and Springville. Those are a fee-based service, and all those fees vary. They're different for each one. They offer different combinations. So, but my staff at 858-8526 is well aware of what the different programs are, so you can call them and they'll help you figure out which one is best for you. Okay, so now I'm going to move into, if you need emergency food assistance, when you call, if you need food right away, if you are in dire need, please let my caseworkers know. We will get food out to you as quickly as possible. Also, too, with regard to home care. With home care, if you need a private aid to help you at home to take care of your personal care needs, that's a program that we offer. Now, we know that a lot of people have become unemployed since COVID-19 pandemic has taken over our lives. Many of you who are over 60 and need a personal care aid have a friend or a family member who is not working and out of work. If you would like that person to help take care of you, someone that is inside your comfort zone in your personal family network, tell my staff that you're interested in the Consumer-Directed Home Care Program. That's for people that are over age 60 and not on Medicaid. We also have personal emergency response systems. This is like the one that goes on your wrist or around your neck. It's a bracelet with a button that if you fall and you need assistance, if you push that button, it will contact your emergency response person. If you need help with health insurance, some people that have become unemployed may not have their health insurance anymore. We offer health insurance counseling to help you figure out what program is best for you. It's an unbiased program. You're not going to be led in the way of the salesperson you're talking to. It's an independent person that works right here at Erie County. Now, transportation. Transportation has been reduced since COVID-19 has kicked off. But it was important to me and the county executive that we kept up transportation for dialysis and essential appointments. So that number is 858-RIDE, which is 7433. What you can do is call them, and as a suggested donation of $3 per ride or $8 for the wheelchair van. So what's on our next slide, Mark? Okay, moving on to combating social isolation. So we all know that this is kind of the next phase of where we're at. So Oasis Senior Advisors has developed a Caring Cards for Senior program. And what they're doing is they're asking volunteers while they're at home to utilize the materials that they have in their house and make homemade cards for seniors. What you can do is call Matt at 717-3664. I believe his email address is on the screen. And he will coordinate the pickup and also the delivery for those cards. Initially, Matt has identified nursing homes and assisted living facilities, and he's also agreed to provide my staff with approximately 400 cards, because we have about 400 vulnerable seniors that are homebound that we are going to get those cards out to, and our staff are calling them once a week to make sure that they are okay. Another program is Catholic Charities. They have the telephone assistance program. That phone number is 218-1400. Again, 218-1400. We ask that you leave a message and they will call you back. They will check on you to see how you're doing. Compierre is another adult program that provides social support. That phone number is 883-3331, extension 314. Again, it's 883-331, extension 314. Okay, those of you who like music, we all know the county executive is doing a daily concert, or every other day, Mark?
Every other day.
Okay, now there's 1,300 seniors that come to the annual Erie County Senior Picnic. It's a 2-day event. You might remember, those of you that attended, there was a gentleman who was our entertainment. His name is Tom Bender. He now is doing concerts. I think he's in competition with Mark, but I'm not sure.
He's better than me.
Yeah. And so if you go to YouTube and you search Tom Bender Music Streaming Live, again, that's Tom Bender Music Streaming Live, you can find Tom's videos and how you can sign up to find out when he loads new ones.
The other thing I'll note, too, we added is a lot of people don't realize this, but our Buffalo and Erie County Public Library system, you can download free music for your own use. So if you have a library card, you can go online and you can actually download to your devices, your phone, your laptops, actually free music, a limited amount per month. But it is a pretty neat service that most people don't realize we have. So just go to the library and check that out.
Thanks, Mark. Also, too, those of you who are seniors and you have not yet embraced social media, okay, this might be the opportunity for you to begin to learn about social media. It's a great way to see pictures of your grandkids and other people in your family and stay connected. So if you need a little help, contact someone in your family who you know who's using social media, and maybe they can teach you how to get set up. Other things that we've identified is reading. You know, we all used to read a lot when we were younger. Reading is good. In-home exercise, spring cleaning, maybe some light yard work. Games and puzzles. These are things that you can do to combat your social isolation. Now, one thing I will tell you that today my senior staff and I has decided we're going to identify our most popular programs that tend to be in a group setting at the senior citizen homes, and we're going to try to go viral with those programs. I don't want to get too much into it, but I think Mr. Fitness might be involved, and we're hoping to find out more about that later on in the week.
That's not me. I'm not Mr. Fitness. That's Richard Durwald.
Yeah, I think he was mentioned a couple weeks ago when you were talking about Peter Anderson's wrestling ring.
Yes, Richard is in his 80s. I won't say exactly how old he is, but when we say Mr. Fitness, he is the senior fitness guru because he's in great shape and he loves helping others exercise.
All right, very good. I think we can move on to the next slide, Mark.
I think might be it for you. Yep. I think you got anything else?
I was going to talk about the nursing homes.
Go ahead. Yes. Okay.
So nursing homes throughout Erie County, there are 35 nursing homes. I sent them all an email this morning, and I'm following up with phone calls. What we're doing is we're checking to see if they're doing okay. If they need some assistance, I provided them with an emergency response form that they can use to order personal protective equipment that they need for their staff to help ensure that their staff and their seniors are safe. So they will be submitting those for the things that they need to the EFS8 at erie.gov. That's EFS8 at erie.gov, or they can call the 858-2300 number for those requests. So I appreciate those of you that have already submitted requests and those who have been friendly on the phone. It's nice to know that people that share a common mission of my department, that we're all working well together. Thank you.
Thank you, David. Thank you for your service to the county. And for those of you who don't know, David serves our country as well. He's a member of the reserves, has been in active duty many times, including in the Iraq-Afghanistan conflict. He's a medic and a Bronze Star recipient, if I remember correctly.
Yes,
So
thank
thank you,
you.
David, for your service.
And actually, while you're talking about veterans, we do have a skeleton crew on for the Veterans Department, and that's 858-6363. So those of you that need help with a claim, have an active claim, my staff is taking turns working every other day, so that resource is still there for you. Again, Erie County Veterans Service Agency, 858-6363. Thank you.
Thanks, David. We're going to go through the rest of these slides pretty quickly. You can open it up to questions. Dan's, I know, got a lot of questions there. We, of course, want everyone to remember that child care for essential workers. If you are a daycare facility and you have open slots, or you're an individual who's an essential employee and you need daycare, please register one of two places: www.wnychildren.org, westernnyyorkchildren.org. That's the Child Care Resource Network of Western New York. And you can call 716-877-6666. So if you need child care, call that number. If you have some open slots as a child care entity, call that number. We want to place people in there. Mental health and wellness, we talked about this yesterday. AA and Narcotics Anonymous meetings are been canceled or postponed until further notice. However, the 24-hour addiction line is available, 716-831-7007. If you are in a crisis situation and you don't know where to turn and you're feeling that there's no hope in the future, please know there is. There's a lot of people who care about you. You know, a lot of people are depressed. A lot of people are stressed out. Anxiety is normal. It's very normal at this point. But we want you to know that there's help out there. There's hope available. If you are feeling that you're on your last string, don't think that way. Call the Crisis Services Hotline at 716-834-3131, the number on the screen, and it's manned 24 hours a day, every day of the year, and someone will be there to show you that hope is available. And then for our friends that may be dealing with domestic violence issues, the hotline number to call is 1-800-942-6906. You can also, if you are in a very dangerous situation, you can call 911 if you have the ability to call. But we want to remind everybody, you can text to 911 too. It's an initiative that my administration put in a few years ago. I want to thank our former Commissioner of Central Police Services, John Glascott, for spearheading that effort. But you can text to 911. So if you're in a dangerous situation and can't call because you're afraid of what might happen if someone heard you call, you can text. Please text. Someone will answer that text, they will respond, and we will react. We will come out there and we will protect you from the person who is abusing you. Once again, mental health and wellness. It's a crazy situation, but we want everyone to take a break, read a book, enjoy, talk to your loved ones, even if it's on the phone. If you got the capability to use this and communicate, FaceTime, things like that, Zoom, go ahead and do it. I've done that with just talking and reading and things like that with others that I've not been able to get in contact with. It's the right thing to do. Play some music. You can borrow some from our library. You can make your own videos, put those online, and maybe people will like them too. But do something to show the rest of the world that you are still out there and you want to communicate with everyone, because while we need to be physically distanced from each other, that does not mean we should socially disconnect. We should still be connected. COVID-19 call center, it's available starting 8 o'clock in the morning till 8 o'clock at night. You've heard the number many times before, 858-2929. Do not call with hypotheticals. Please call with actual issues that you're dealing with. Someone is there to answer the phone, to answer your questions. If you are calling about a doctor or a physician or healthcare provider, there's a specific number for you to, or button for you to press when you get in, so you can be directed to the correct individuals. But this is not an answering service. This is not your call in India. You're actually talking to people who are in this building, in the Rath building, on various floors, because we've got so many of them now. But you will talk to a real person. Lots of websites, lots of information. Once again, that's available from the national CDC site, which is just coronavirus.com. Excuse me, is it coronavirus.com? Coronavirus.gov. Coronavirus.gov to the Erie County site. It is updated. at least daily with the more information as we get it, so people can get accurate information. I just want to remind everybody we're here. We're going to be here through the duration. I've been sending people home that have been working too hard because I don't want them to burn out. So there's some people in my office who have off today. There's some people in the health department who have off today. And I just want to thank each and every one of the individuals who's been working on behalf of the greater community for the good that you're doing to protect our public. Dr. Gail Burstein is here every day. I've been here every day, but taking off a little bit every now and then from a standpoint of I'm not here 16 hours. I want to thank everybody who's been concerned about my well-being. I'm getting sleep, so I am getting sleep. Occasionally I'll put a music video up, maybe another tonight. I don't know. We'll see how busy I am, because sometimes I have conference calls till late in the night. But I want people to understand that we're taking this seriously, and we're also watching out for our own well-being, because it doesn't help anyone if I burn out, if David burns out, if Kate burns out, if our friend Mark Leffler sitting over there, who's been helping us out from the Department of DPW, Buildings and Grounds, burns out. Monica behind the phone, she was off yesterday, right, Monica? Right. Yeah, she was off yesterday. Dan Meyer, he's been off. And with that, I'm going to turn it over to Dan to start asking some questions, which I'll repeat into the microphone.
Sure. Various things. First one, Mark, is actually a few different people want to compliment us on the map, and it's very user-friendly. People can look at it on a regular basis. And on that, someone asked, on behalf of someone who is one of the 116 active cases, do you have any guidance or advice for someone? These are obviously very stressful and uncertain times, but do you have any advice, either what the county could possibly do, or just your own personal advice on how people who are one of the active cases can cope with waiting to find out in terms of their own health and their long-term prognosis?
We're talking about the COVID-19 map, which you see I just put on the screen and then updated, and we have the most recent figures. They were very appreciative of it, but they also know what, if they were an individual who is positive, tested positive, what they can do to help with their own mental wellness issues. And I think it's important for people to realize that a lot of people are scared out there about COVID-19, but there's also a number of individuals who have it in our community. And we want people to understand that they are really stressed about what could happen. As we noted, the good thing today is we identified that there's 4 recovered, that individuals who had COVID-19 are now recovered from COVID-19. So it does show that you can recover from this illness. There's lots of helplines that are available if you want to just talk to somebody, including about your illness yourself. You could always call the 858-2929 phone number. There's many help lines and assistance that are out there to ensure that people who are in a stressful situation such as this can get their questions answered, whether it's the crisis services helplines, some of the ones that we have in county government, the mental health office of New York State offers a helpline as well. I had that number previously. Unfortunately, I don't have it right now. But what the biggest thing I want you to know is that if you are tested positive, you should be in isolation, which is not a great thing. No one wants to be in isolation. You should monitor your symptoms. You should be in contact with your doctor. You will be in contact with an epidemiologist or a member from our epidemiologist staff from the Erie County Department of Health to keep track of your symptoms. We want you to know you're not going to go through this alone. You may have to be by yourself in a room from the rest of your family or others, but we don't want you to go through this alone. We want you to know we're here for you as a community, and what I really want to see more of is no more of those deaths. I want to see that green number recovered go up. And I'm hoping by the end of today we're actually able to add 1 or 2 more if individuals get through the period of time after they first showed symptoms and were tested positive, then maybe we can add that on the recovered. So to those of you who have COVID-19 at home who may be watching this, including the individual who wrote a message, just know that we're here for you, and don't be afraid to call us, and we'll be calling you too to check and make certain that everything's okay. Next question.
Next one is regarding the federal stimulus package, and specifically money coming to Erie County. Can you talk a little bit more about the funding, what it would be used for, things along those lines?
The questions in regards to the federal stimulus package and what will be coming to Erie County, if anything. I want to thank Senator Chuck Schumer for his strong advocacy to get a federal stimulus package through that helps not only local businesses, national businesses, states, but it's my understanding that Erie County will be part of that package for approximately $160 million of assistance, which is to help us cope with the response to COVID-19 as well as the loss of potential revenue. I don't have all the specifics of whether that's paid out over 1 year or an extended period, but I do thank Senator Schumer and, of course, Congressman Brian Higgins locally for fighting very hard to ensure that local governments, or at least those that are, I know, over a population size of 500,000 or more, are provided the resources they need to react and respond to this crisis. We know it's going to be very expensive in the long run to do it. We're spending a lot of money from the initial $5 million that we designated, just even on purchasing food for first responders, ensuring that we have a place for homeless people to go. And I'm really thankful that Senator Schumer was able to come up very strong. As I said, we've been told it's $159 million that'll be provided to Erie County. I don't know all the specifics, if that's over a 1 year period, if it's a longer period, and everything associated with it. But if that's what we're eligible for in the long run, it really is going to help us get through this as a municipality with, one, the cost of response, and two, what we know will happen, which is the loss of revenue that we did expect to receive because of all the shutdowns. Next question.
Next question, we get this quite a bit, retrofitting sites. One that's referenced often is the old Erie County home in Alden. Also some references to some recently closed schools. What is Erie County doing, working with the state and other entities, and maybe looking at some options here for temporary hospital facilities?
The question is retrofitting sites. What is Erie County doing to work to potentially retrofit older sites so they can be turned into hospital facilities? We have looked at a number of locations, including hotels. We've excluded some because they just don't have the capabilities that we need. We're looking at other locations potentially for mass casualty ICU bed locations, and what we're thinking about is we may be looking at the convention center. We've actually done some initial analysis with regards to the convention center and the exhibit hall in the convention center. If we needed to have that much, it's best to have individuals in a location where you can have like one hot zone, so you don't have to constantly put on and off PPEs for medical professionals. So we're looking at that. We also have a couple other sites that we're identifying for people who do not have the illness but need housing, supportive housing, whether it's homeless or individuals for other reasons have housing issues. So there's a number of things we're doing. We're working with our local partners in the private sector and the public sector in identifying that. We'll continue to do that, but as of right now, we don't have any one set location identified. We have taken a look at the Erie County home. If we had to convert a portion of it, we could, but it's more of a long-term issue, so right now it's not on the agenda. It's more on the back burner. If we had to convert the Erie County home, we could do it, but that's more months away as compared to some of the stuff that we feel we could get done in a very short period of time, including having conversations with the Army Corps of Engineers that if we get decreed to have a hospital, they could help us basically create a hospital, not build the building, but build a location for the hospital, and then work with our partners to man it. Next question.
Next question, this is probably directed to you and Commissioner Shank regarding parks. You've made it clear that while Chestnut Ridge is our crown jewel, we want to see people visiting other parks. A couple in their 60s that would like to go to a park besides Chestnut Ridge. Could Mark, you or Dave maybe share advice on a couple different places to visit or check out? Sure.
The question is on parks. People want to go to parks, but they're a little worried about going to a park that's crazy like Chestnut Ridge or Delaware. And as I said, we have many other parks. The issue is people in their 60s. What's a good park? Depends on where you live, but a great park in the Lancaster area is Como Lake Park. It's got a beautiful area, nice little walking paths. It's flat, so it's not that easy, or it's not that difficult to get around. Emery Park out in Wales, Aurora area is a gorgeous park. It's a little hillier, but it's got great walking trails, beautiful scenery, nice place to go to. In the north towns, of course, we have two major parks, Ellicott Creek Park in the Tonawandas, right on the Tonawanda-Amherst border along Niagara Falls Boulevard. Ellicott Creek Park, nice little park too, flat so it's easy to walk if you're a senior. Akron Falls Park, a little bit more elevation changes there, and of course the beautiful Akron Falls. If you've never seen it, something you should see. Those are parks across our county. If you live in the southern part of the county, we have Spraguebrook, right basically across the street from Kissing Bridge South on 240. Gorgeous park, a little hillier. Got some good trails, but maybe not the trails for someone who's a senior who is not used to walking on trails, but just a beautiful place as well. Commissioner Shank, you got any other ideas on places to go?
Yes, of course. Obviously, Mark is always going to showcase the county parks that we have, and if you want to see the complete list, you can go to erie.gov and then scroll down to departments and then click on parks, and you can find the entire list. And they're usually broken up into two categories: developed parks, which Mark is kind of showcased, and there's some undeveloped parks that pretty much just have a small parking area. Like where I'm from in Boston, we have the Boston Forest, which is probably one of the largest pieces of county parkland, but it's undeveloped. But there are some trails that you could utilize. Also, many of the towns and villages have parks that you can use, and I believe the state has a few parks in Erie County. So there's many places that you could go to, but it's important to keep your group down to just the people that you live with. Don't call everyone in your welcome wagon group to go for a group walk of 20 people.
Good point of view. I saw a post from someone earlier today that they went to Niagara Falls State Park. Hadn't been there in a while. And they said it was eerily silent. There was just a few people when they pulled into the parking lot. They went to Terrapin Point. There were only a few people walking around, and we got one of the natural wonders of the world. So it sounds like Niagara Falls State Park would be a good place to go to as well. And one thing we know, there's no tourists. There are no tourists coming to Niagara Falls on both the American and the Canadian side right now. So it'd also be a good place to go for a walk.
Okay.
Daniel, what else we got?
My tally's right here. We've got 3 different questions from media, 2 different from citizens of Erie County. A lot of questions about experimental drugs, some different things. The president, a few other people. There's a lot of suggestions online about doing combination of different things. What is your advice on people that want to take drugs that may not be prescribed by a doctor or medical physician in terms of potentially fighting off COVID-19?
The question is with regards to drugs, and there's a lot of questions out there, and you've heard about experimental drugs and treatments that may be available. I am not a doctor. I'm a doctor of law, as it is, because I'm an attorney, but I'm not a medical doctor, and I do not play one on TV. So I'm going to tell you the best advice you can do is talk to your own doctor, your own healthcare provider, about what is available if you should happen to have COVID-19. I am not aware of any experimental treatment that's being provided locally. Perhaps that has started, but the only ones who would know that are the doctors. So if you have a question with regards to experimental treatments, right now my understanding is there is no vaccine, there is no real treatment for this. They're experimenting with different things, but just don't go out there and take something because you heard somebody say it. Talk to your doctor before you do anything. Next question, Dan.
Next question, a fiscal-related question for the county, and obviously we're very early in this crisis, but with most of March and probably April resulting in a drop in sales tax revenue, plus we're looking at some bed tax loss, do you have any idea on how this may impact the Erie County budget, both in the short and long term, in terms of money reserved and how we're going to address, which is obviously less total income coming into our region?
The question is in regards to the Erie County budget and the impact this will have, and do we have projections? Well, we have some ideas based on estimates that we've received from the financial institutions as well as the federal government. I want to give a shout out to M&T CEO Renee Jones, who I've been in contact with. They've shared some information that they have with regards to modeling of what the economy would be, so we could do an estimate. We do anticipate to lose millions of dollars of revenue in the second. We're not even in the second quarter yet because we're still in the first quarter of 2020, but the second quarter of 20. We did pretty good for January and February, so we probably get through the first quarter of 2020 okay, but the second quarter is not going to be good. We know that if this is prolonged, and we think it will be prolonged. And that's why the stimulus package and the assistance package that was passed yesterday by the House and Senate was so important, because it's going to help us make up for the lost revenue. Now, as a government, we actually have a really strong fund balance. It's over 400 million, or not 400 million, excuse me. I wish it was over 400 million. We have a fund balance that's over 100 million. Now, the fund balance is our piggy bank. So that's what we could tap into if we needed to in an emergency situation, and this is an emergency situation. We haven't had to tap into it yet. We've designated $5 million from the 2019 surplus that we know we're going to have for 2020 resources. If we need to tap into the piggy bank, we can, and we would do that if necessary. We will do that especially if the cost has to be spent, but now that we know we're gonna get some money back from the federal government, so it gives us peace of mind that we're not gonna lose our piggy bank in the long run because of this. Next question.
Next question, all right. This one comes in regards to questions for Commissioner Shank.
A question for Commissioner Shank.
Dan, could you repeat the two phone numbers you listed earlier regarding the phone number, the 858 number for RIDE and also for veteran? We have someone who is looking for scheduling a very important doctor appointment that is
Just
not
repeat
going to
the
be
question.
canceled, and also this person's a veteran and has a question for the
Senior and veteran questions.
Okay, first off, that's a two-part question, and I want to say thank you for those two questions. The first one was the caller wanted me to repeat the number for the county senior van. That number is 858-RIDE, R-I-D-E, and if memory serves, it's 7433, R-I-D-E, and that's for the county going places van. Then with regard to veterans, if you need help with filing a veteran's claim, you can call 858-6363. So that's the phone number for the Erie County Veteran Service Agency. We have one veteran service officer answering that phone every single day. Thank you.
Next question comes regarding the testing centers. Mark, can you just clarify, if someone goes for a drive-through test center facility, what's the protocol and procedure for how they would visit one of those locations?
The question is in regards to drive-through testing centers. Do we have them? What's the protocol? First, we do have the testing swab kits again, and I want to thank Governor Cuomo and his staff for securing hundreds of them for us. I believe we have 600, which should get us through a number of days. Are there drive-through testing centers? There are, but they are not just general public showing up. You need to have your test confirmed by the Erie County Department of Health in consult with your physician. So you have to fit those certain protocols I talked about earlier. You just don't show up and get tested. We do not have those because we do not have enough test kits or reagents to do everybody who wants a test. New York right now is recommending only certain people get tested by the public health departments, including their own state department. And there are others who, based on their non-symptoms or the situation associated with them, wouldn't get tested. There are private entities that are performing tests. Now, when I say tests, like Quest and LabCorp, if they get the swabs provided to them, they will do the test, but someone else has to do the swabbing. So if your healthcare provider has the ability to do it, and a lot of urgent cares do, as well as, hospitals and doctors' practices, not every of them do, but many do, they can swab on site, and then that could be sent to Quest or LabCorp for them to test, but they don't actually do the swabbing. There is one drive-through location, but that is only available to those who have been pre-approved by the Erie County Department of Health Public Health Lab, as well as their doctor, and it's not just a drop-in site where you get tested. Next question.
Next question is a rather unique one, but a couple different people have asked in some fashion or another.
A unique one.
Any advice on gasoline? And it sounds like this may be something that started online in terms of getting gasoline, your general care for yourself, your hands, protecting your hands. People are asking about going to pump their gas. A lot of people are doing a lot of driving lately, but they decide they have to get gas. Any advice on that? Anything they should be worried about or concerned about?
Question is about getting gasoline. Should they be concerned about their hands and whether they could get the virus from touching the pumps? There's no gasoline shortage, so first off, if there's any rumors out there, there's not. Gas is available, and it's actually pretty cheap right now. What I do and what we're recommending is if you have hand sanitizers or the spray pump type stuff, keep some in your car. So I went out and got gas a few days ago. I made certain I washed my hands before I wiped them. I sanitized them before. Had the sprayed it, sanitized my hand, used the pump, put my credit card in, used the pump, and then before I did anything else, I re-sanitized my hands right afterwards. So if there was any germs or virus on the pump that it could have been transferred to my hands, I immediately sanitized myself. And I would recommend that people do the same thing. So carry some hand sanitizer with you, carry some wipes. If you're worried about touching the touch screen, a lot of gas stations, you can still go in and talk to the person in person and purchase the gas in person. So if you don't want to touch the touch screens, you can do that. But always use smart protocols and practices when you go out into the public in a situation like that where you're touching screens where other people have actually touched. Or if you're using the keypads in a store, the same thing.
Next question.
Two more questions.
Yeah,
I
sure,
think.
sounds good. This can be directed to both Mark and Commissioner Shank. Nursing home residents, family members of nursing homes, can you give these people some advice, some reassurances, anything they can do in these times when they're not going to be able to see these folks for a while, but anything else that they can do, for lack of a better term, on the outside looking in terms of looking out for their loved ones, and then they can do as advocates for our senior community?
Questions about nursing homes and what people can do if they have loved ones in a nursing home and they can't see them because they're prohibited right now? Commissioner?
So as a matter of fact, earlier on, I mentioned that I've been reaching out to the nursing homes, and the one nursing home that I spoke with has come up with some very creative ideas. What they're doing is for their residents that live on the first floor, they're having the family members come to just outside the window. So they're able to see each other that way, which is good. They're also helping some of their clients establish some FaceTime, and they're utilizing some social media techniques and also Skype. So some of the nursing homes are being creative with that. And if your nursing home that your loved one is in is not doing that, I suggest you call them and make the suggestion. Or maybe you could buy mom, dad, grandpa, or that elderly person in your family a phone, and take them the phone and ask that a staff member there show them how to use it.
Thank you, Commissioner. One last question, and we got to run.
Last question is a two-parter, Mark.
Two-parter question.
People are looking to recreate, and they're looking for your personal advice. They've been a fan of your first two music videos.
Uh-oh, music videos.
Suggestion for a Johnny Cash song.
Okay.
So keep that
We
in
have
mind.
suggestions for songs. I won't say it in case you didn't hear it, because maybe I'll play it, maybe I won't. But we have.
The question is, can you personally recommend to someone in their 50s, sounds about your age bracket,
It's both of us.
Can I personally recommend to someone in their 50s?
one classic feel-good movie to watch and one good book to watch? Now, books obviously may be a challenge depending on your shelf or not, but one good book and one good movie for people to help pass the time.
One good book and one good movie. Well, I think at this point we want to have a movie that has a good, happy ending. I grew up, I remember one of the first movies I remember, I was 10 years old, Star Wars. It's got a great finish. The good guys win out. So if you want to have some action, adventure, you can watch it with the whole family. You don't have to worry about a bad word or anything like that. It's even got a Wookiee in it. I'd go with Star Wars. Books, I'm actually reading a book right now. It's on leadership by General Colin Powell. I actually had an opportunity to hear General Colin Powell not too long ago in person. Outstanding storyteller, and his book is great. If you don't have an opportunity to do that, you might want to pick up a biography. The library, of course, you can download ebooks. There's thousands of ebooks available to download. So if you want to read a different book, go to the library site. I've also been reading some of the classics lately, which is really interesting when you read some of these. And when I talk about classics, I'm talking about Greek classics. I'd like to kind of break away some way from what we're dealing with now, but when you read these Greek classics and realize that our human condition has been dealing with some of these issues for millennia, it just remembers and puts us in our place and where we stand in this world, and we're just one little tiny speck in the overall universe, and we're just one little speck and grain of sand, so to speak, in the history of this world. When we realize that the things we're dealing with today in this pandemic is really no different than what they were dealing with 100 years ago, during the Middle Ages, during Egyptian times, and before that. So it's kind of neat reading that. I would say find something you like, download it from the library. If you got a library card, you can do that for free to any of your devices, and just enjoy it. David, you got any suggestions?
Yeah, for movies, Mark, I would say that Forrest Gump is one of my favorite movies, and also Mr. Holland's Opus. What I like about both those movies is they take you through, there's multiple decades of time, and they reference many different historical events that happened throughout our lifetime, and those are two movies that I really enjoy.
Good choices. Thank you, everyone. As always, you can get information on what's going on with regards to the coronavirus response in Erie County at our webpage, as well as if you have specific questions, at our phone number, 858-2929. I want everybody to know that seems like it's been forever. I'm already losing track of what day it is, but we're going to get through this by working together, and working together we'll be stronger for it. Thanks, everyone. Until I see you again, have a great day, and Maybe I'll have a video later tonight, maybe not, but no matter what, there will be one in the future. Take care, everyone.
Thank you.